difference between gluten intolerance and gluten sensitivity. And I'm going to break some news to you. There isn't a difference between gluten intolerance and gluten sensitivity. It's the same thing. And actually, celiac disease is a form of gluten intolerance. So those with celiac disease are, in fact, gluten intolerant. I know that is a surprise to a lot of people, and was a surprise to me when I first heard it. So, but we're going to talk a little bit kind of about, you know, gluten intolerance. A lot of people, and like what it is exactly. A lot of people recently have been saying they're gluten intolerant as far as, you know, athletes and movie stars, and you hear the term gluten intolerant a lot more these days than you typically would. So I'm going to talk just a little bit about that. So gluten intolerance symptoms actually mirror those involved with celiac disease. And even though there's no medical consensus on diagnosing gluten intolerance, some physicians are telling people that's what they have. And people who've gotten a diagnosis of gluten intolerance or gluten sensitivity have symptoms that look an awful lot like celiac disease. In fact, it's impossible to differentiate between the two on the basis of symptoms alone. Symptoms such as diarrhea, constipation, bloating, and abdominal pain occur freely and frequently in those who have been diagnosed with gluten intolerance and in those who report effects but don't have a diagnosis. Fatigue, joint pain, headaches, and brain fog are also common. However, it's not clear whether these symptoms indicate damage to your body's organs or whether they just indicate you've eaten something that doesn't agree with you. Unlike diagnosed celiacs, those who may be gluten intolerant don't experience damage to their intestinal villi. Some researchers say people who are gluten intolerant or gluten sensitive actually can experience damage to other organs and systems, but this has not been proven yet. So basically, celiac, you know, it damages the villi in your small intestine. That's why people with celiac are so malnourished, because they're not absorbing any nutrients. But they're saying that some doctors are saying that people with gluten intolerance or gluten sensitivity, which is the same thing, may be actually experiencing damage to other organs and systems, not necessarily their small intestine. So there's not a lot of options for testing gluten intolerance. There's not really a gluten intolerance test so much. It's more testing for other things, ruling them out, and then kind of giving a gluten intolerance diagnosis. So since many researchers do not agree that gluten intolerance exists, there's no proven test to diagnose the condition. So what can you do to test for it if you think this may be your problem? First, you and your physician should test for celiac disease, which will most likely mean screening for the condition using the standard celiac blood test panel. It may also involve doing one of the celiac gene tests, which are involved in most cases of celiac. If your celiac blood tests come back negative, it's likely that you don't have celiac, although occasionally false negatives do occur. In that case, you have a few options for gluten intolerance testing, although none of these options have been validated by medical research. So what they would say to do, some physicians will use positive results on certain blood tests that look directly for gluten antibodies in your blood, to diagnose gluten intolerance. A few others will diagnose it on the basis of dietary response. In other words, if you eliminate gluten from your diet and feel better, you are in turn gluten intolerant. So, and you also have the option of a direct-to-consumer gluten sensitivity testing through Intero Lab. Just be aware the testing methodology used by this lab hasn't been proven or accepted by most physicians. You can order that and test yourself at home. I'm going to link you back to this article. It is by Jane Anderson from celiac disease at about.com, and you can read the whole article yourself. But I thought it was very interesting. So hope everyone's doing well out there, and as always, it's from have not to have and gluten-free dining.